Assalamu alaikum everyone, this is Hamza Hussain and welcome to Pakistan Cardiac Society Cardiac Super League powered by Wilson's Pharmaceutical. Today once again we are live for the second quarter final which is between AKUH Stars and MAYO Kingfishers. Allow me to introduce the panelists of today's match. Today we have with us the umpire of match, Professor Mohammad Isaac. He is Professor of Cardiology at Karachi Institute of Heart Disease, and along with him, his second umpire is Professor Khawar Abbas Kazmi. He is Consultant of Preventive Cardiology at National Institute of Cardiovascular Disease. And moderator of today's program is Dr. Ashraf Bilal. He is Consultant Intervention Cardiologist at Karachi Institute of Heart Disease. And I would now request Dr. Ashraf Bilal to please start the proceeding of this second quarter final between Aga Khan Stars and MAYO Kingfishers.
Assalamu alaikum, bismillahirrahmanirrahim. Thank you, Hamza, for your kind words. I would like to first of all welcome to both Professor Mohammad Ishaq and Professor Khawar Kazmi. They already joined us, and shortly I think our panelists will join us as well, which includes Professor Feroz Mehman and Assistant Professor Imran Iftikhar from RIC. So now I would like to move towards both teams. First of all, I would like to move towards Aga Khan Stars. Please introduce your team captain and your team members, please. Aga Khan Stars.
Assalamu alaikum. My name is Dr. Mohammad Ahmed Tamiz and I'm the captain of AKU Stars. On my left is Dr. Rizwan Ali Khwaja. On my right is Dr. Asfandiar, Dr. Umair Javed, and all the best to the Mayo Hospital.
Thank you, Dr. Tamiz. Thank you very much. Now with this, I would like to move towards MAYO Kingfisher. Please introduce your captain and your team members. Thank you.
I am Dr. Muzammil Amin. I am the team captain. And on my left is Dr. Taki. And on my right is Dr. Rashid and Dr. Abdul.
Sorry, Dr. Nadeem, just please close the mic to your, mouth, please.
Okay.
Yes, now.
I am Dr. Muzammil Amin. I am the team captain. And on my left is Dr. Taki. And on my right is Dr. Rashid and Dr. Afzal.
Okay, welcome you all, guys. As you know, I think you guys, both teams have played this match before as well. So first of all, I would like to choose MAYO Kingfisher. You can choose the electronic coin toss. So it's your turn. You want to choose head or tail? Just let us know.
Tails.
Okay. Hamza, it's over to you. Please do the coin toss now. Hamza, can you make the screen big for coin toss?
Sir, kindly pin Cardiac Super League window.
Please pin Cardiac Super League window. Okay, so Hamza, who, because I cannot see properly, who won the toss?
It's tails.
Okay, MAYO Kingfisher, you won the toss. Congratulations. So what do you want to decide? You want to ball first or you want to bat first?
It means answer first.
Okay, so you want to bat first. Okay, that's good. So Aga Khan Stars, you have to ask the questions. Hamza, please put the questions for MAYO Kingfishers scenario and then the questions. It should be big for me. Yes.
Okay, so the scenario is a 28-year-old man, an accountant by profession, came to visit an OPD with an episode of syncope. He described this episode as sudden blackout while climbing stairs. On inquiry, he mentioned that he had some problem in climbing stairs for almost last 1 year, so he generally avoided to climb stairs. But yesterday he had to rush because lift was out of order. He said that he recovered from this episode within minutes, as told by his colleagues. On examination, his blood pressure is 100 by 70 millimeter of mercury, pulse is 71 beats per minute, regular. In precordium, there is an ejection systolic murmur at base of 3 by 6 in intensity, radiating to the carotids and accentuated with held expiration.
Okay, so that's the scenario now. Aga Khan, just please ask your first question.
Question number 1 is, all of below are true in this disease except option A, pressure drop across the valve doesn't occur until valve area reduced by 50%. Option B, a prominent murmur doesn't appear until severity is at least of moderate size. Option C, LV dilatation on chest X-ray is not a typical feature in compensated disease. Option D, character of the carotid pulse will be typically slow rising and of small volume in severe disease. And option E, anacrotic notch may be present.
Okay, Mayo Kingfisher, your time starts now. Okay, Kingfisher, 45 seconds left.
So Professor Feroz Mehman Saab has also joined us.
Okay, we would like to welcome Professor Feroz Mehman Saab. He is the chairperson at ISPA University, Hyderabad. Welcome.
We will go with option C.
Okay.
Thank you, sir.
Okay. Okay. So Hamza, please lock option C. Lock option C. Oh, bad luck, Mayo Kingfisher. No issues. It was just the first question. So we will move with this to question number 2. Yes, Aga Khan starts. Please ask your second question.
Okay. So the second question is, patient is examined by your consultant and he described this disease as severe stenosis. All of the following physical findings will be present in this patient except option A, pulsus parvus et tardus. Option B, prominent S4. Option C, apical left ventricular lift lasting less than 50% of systole. Option D, reverse splitting of the second heart sound. And option E, peaking of murmur intensity is in late half of systole.
Okay, Kingfisher, your time starts now. Okay, Kingfisher, we are unable to hear your conversation or your discussion. Is it possible we can hear that as well?
We will go with option C. Sir, Mike, I think.
Yeah, just if you can just, if you are discussing the answer, just please close your mic. Okay, Hamza, you can stop the timer now. And you want us to go with option C?
Yes, sir.
Okay, Hamza, please lock option C. Very good, fantastic. So that's right. First sixer from Kingfisher side. Okay, with this, Aga Khan, please ask your question number 3.
So question number 3 is, a patient was sent for echocardiography to confirm the diagnosis. Echocardiographer mentioned severe aortic stenosis in conclusion. Following echocardiographic findings will be present in this patient except option A, Vmax will be more than 4 meter per second. Option B, peak gradient across aortic valve will be more than 65 millimeter of mercury. Option C, mean gradient across valve will be more than 40 millimeter of mercury. Option D, indexed aortic valve area will be less than 1 centimeter square. And option E, concentric left ventricular hypertrophy may be present.
Okay, Kingfisher, your time starts now. Okay, now both team has 4 members, huh? Okay, 50 seconds left.
Sir, we will go with option D.
Okay, are you sure you still have 45 seconds left? You can think again if you want.
Yes, sir, we are sure.
Okay, Hamza, stop timer and please lock option D. D for Delta. Okay, right answer. Congratulations. Okay, with this right answer, we will move towards question number 4. Please, stars, ask your next question.
Question number 4. Patient was admitted in ward for further plan. Consultant in morning and asked to generate call for cardiothoracic surgery for discussion. CTS resident came and advised AVR for this patient with bileaflet metallic prosthesis. All are the characteristics of this valve on echocardiography except option A, antegrade velocity is less than 2.5 meter per second with a triangular flow curve. Option B, mild eccentric AR due to occlude closure. Option C, complex fluid dynamics. Option D, reverberations and artifacts. Option E, excellent long-term durability.
Okay, Kingfishers, your time starts now.
So we are not able to hear the discussion. I think we are supposed to turn on the mic.
Yes, Kingfisher, if you can just close your mic, so we can hear your
Mic is
discussion
turned
as
on.
well.
We don't have off button on this mic.
Okay, you have 55 seconds left. Okay, Kingfisher, 35 seconds left. Hamza, timer, I cannot see the timer, Hamza, please. Timer is gone, so I would like to see the timer. I don't know how many seconds left. Maybe 20 seconds left now. Kingfishers, please. 8 seconds, 7 seconds left.
We will go with option A.
Okay, stop the timer and lock option A, Hamza, please. Right answer. Thank you very much. Congratulations again, Kingfisher. With this right answer, I would like to ask Aga Khan to ask their 5th question. Please proceed, Aga Khan.
Okay, before moving on to the next question, we have a request that we cannot hear the discussion of the second team, and as we are told that we have to turn on our mic so that others can listen to the discussion.
I actually asked them, can our team, technical team, can just adjust their mic in Mayo Kingfisher, please? Anyhow, Kingfisher, we can able to listen your answer. So how is it not possible that we cannot able to listen your discussion?
This mic.
Are you guys turning off the mic?
No, we don't have on this mic.
Usher, also we are not seeing the score. Used to display the score in the past, so please.
Yeah, I think Hamza changed the format little bit today. So no, I think the score is coming. Sir, if you can just make your screen large, you can see the scores as well. It's coming up down. यार ये मेरा भी नीचे करो तो स्कोर नजर आएंगे.
स्कोर नजर नहीं आ रहा कहीं.
सर वो आपकी स्क्रीन में नीचे ना वो चैट और वो सब आ रहा होगा, उसको आप करेंगे तो स्कोर आना शुरू हो जाएंगे.
नहीं पूरा आया हुआ है, लेकिन चले, मुझे कोई इतनी वो नहीं है.
मेरी स्क्रीन में तो नीचे आ रहा है 18 पॉइंट्स हो गए हैं इनके, 18 रन हो गए हैं.
प्रोफेसर साहब आप कार्डिक सुपर लीग की विंडो को डबल क्लिक कर दें बस.
कार्डिक सुपर लीग की विंडो. अच्छा चलिए ठीक है, ओके. खबर आपको आ रहा है स्कोर नजर?
नहीं, हम सब्सक्राइब कर रहे हैं, मुझे तो वही वाले लेकर आओ जो ऊपर आ रहे थे मेरे लिए. हाँ बोलिए. ओके दैट्स फाइन. वेयर इज
जी आ रहा है, अगर उसको आप फुल स्क्रीन कर दें तो.
ओके, सो शुड वी प्रोसीड? Kingfishers, can you just from now onwards, if you are just when we ask the questions and you guys are discussing the answers, please keep your mic open and close to your faces, so we can hear your discussion as well. Is it okay? Can you just reply to me, Kingfishers?
Yes, sir.
Okay, that's fine. Okay, thank you. So, Aga Khan, start. You can ask your next question, please.
Okay.
Hamza, put the next question.
So question number 5, patient is planned for AVR and advised for dental workup in order to avoid prosthetic valve infection. A small dental abscess was present, which was drained. Patient had AVR after 7 days of antibiotic course. On second post-op day, surgeon requested for bedside echo. Aortic valve peak gradient was 55 millimeter of mercury. All of the following may be a cause of these gradients in this patient except tachycardia. Option B, patient prosthetic prosthesis mismatch. Option C, bradycardia. Option D, anemia. Option E, fever.
Okay, Kingfisher, your time starts now. Yes, Kingfisher, we were unable to hear your discussion again. Can you just close your mic, please? 45 seconds left. Guys, is it possible? And Hamza, I even cannot see them. Can you just, Kingfisher, it's not coming up on my screen as a. 30 seconds left. Hamza, are you hearing me?
Yes, sir, I'm hearing it.
Yes, I cannot see Kingfisher. At least we should see the Kingfisher. 19 seconds left. Yes, Kingfisher.
Sir, option C.
Okay, we should, Hamza, stop the timer and lock option C, please. Okay, it's right answer. Hamza, I cannot see Kingfishers, please. Why I cannot see them? Hamza, sort this out first before we ask the next question.
Sir, Kingfisher is visible.
तुम करो कुछ भाई क्या हुआ है? कहाँ Kingfisher किधर है? हाँ मुझे ये बस ये रहने दे ताकि मुझे पता हो क्या करना है यार. Sorry sir, I want to see ke they are visible at least. If we cannot see their voice or discussion, at least they are visible to us. Okay, Aga Khan, please ask your next question, please.
Okay.
Hamza, please. Yes.
So question number 6, patient is being evaluated for persistent increase in transvalvular gradient of prosthetic valve. You are suspecting patient prosthesis mismatch in this patient. All of the following are characteristics of PPM except option A, Vmax more than 3 meter per second. Option D, DVI less than 0.35. Option C, effective orifice area indexed less than 0.85 centimeter square per meter square. Option D, acceleration time more than 80 milliseconds. And option E, acceleration time by ejection time is more than 0.32.
Okay, your time starts now, Kingfishers. Okay, Kingfisher, 50 seconds left. Keep putting their mic down.
Sir, we will go with option D.
Okay, that's your final answer.
Yes, sir.
Okay, Hamza, stop the timer and lock option D. Oh, wrong answer. Okay, no worries. You're playing very well. No worries. Okay, with this, Alhan, please ask your question number 7.
So question number 7. Luckily, patient is not having ppm. He was discharged in stable condition. He came for follow-up after a month with INR of 0.9. He said that he is taking medicines as prescribed. On inquiry, he said that he's taking vegetarian diet only. You are suspecting that he took vegetables who are enriched with vitamin K. Recommended daily intake of vitamin K in male is 80 milligrams per day, 90 milligrams per day, 100 milligrams per day, 110 milligrams per day, or 120 milligrams per day.
Okay, Kingfisher, your time starts now. Tricky question, huh? Unexpected question, huh? Okay. Okay, Kingfisher, 50 seconds left.
We cannot hear them.
Yeah, actually, they used to drop their mic, down. So that's why. 30 seconds left, Kingfishers.
Option A.
Okay. Is it final with you?
Yes, sir.
Okay, Hamza, stop the timer and lock option A. Lock option A. Okay. Okay, wrong answer this time. Better luck next time. And with this, Arfan, please ask your question number 8.
Question number 8. After counseling regarding drug interactions with vegetables, dose of warfarin is changed. He came after 15 days with his fresh report of INR. It is now 7.9. He is not having any history of bleeding from anywhere. What should be the immediate treatment? Option A, no need to panic. Counsel patient that it's not a big issue. Reduce the dose and follow up after 15 days. Option B, stop warfarin. Check INR regularly. Restart once the INR is in therapeutic range. Option C, stop warfarin, give oral vitamin K 10 mg stat, give INR, check INR regularly, restart once the INR is in therapeutic range. Option D, stop warfarin, give IV vitamin K 10 mg stat, check INR regularly, restart once the INR is in therapeutic range. Option E, stop warfarin, give IV vitamin K 10 mg twice a day for 1 day, check INR regularly, restart once the INR is in therapeutic range.
Okay, your time starts now, Kingfishers.
The Professor Fawad Farooq Sahab has joined in.
Okay, we would like to welcome Professor Fawad Farooq as well. Dr. Fawad, welcome to the game as well. Okay, okay, 50 seconds left, Kingfishers. Thirty seconds left. Kingfisher, 15 seconds left for you.
We will go with option C.
Okay, Hamza, stop the timer and lock option C. Oh, no problem. Better luck next time. So with this, we will gonna move towards our second last question. So Aga Khan, stars, please ask the second last question.
Question number 9. Patient was admitted in ward for monitoring. Warfarin was stopped. House officer in ward was very enthusiastic and curious regarding IV medicines. All of the following are recommended management in case of bleeding with anticoagulant overdose, except option A, 4-factor prothrombin complex concentrate includes factor 2, factor 7, factor 9, and factor 10 is recommended in life-threatening bleed with warfarin. Option B, vitamin K is recommended if resumption of vitamin K antagonist is not anticipated within 7 days, in addition to 4-factor prothrombin complex concentrate in case of life-threatening bleed warfarin. And option C, adarucizumab, 2.5 mg bolus infusions no more than 15 minutes apart is indicated to reverse the effect of dabigatran when clinically indicated. Option D, vitamin K is not recommended in patients receiving vitamin K antagonist therapy with an INR between 7.0 to 10.0 and without bleeding. And option E, none of the above.
Okay, your time starts now, Kingfisher. Okay, 35 seconds left, Kingfisher. Okay, 20 seconds left for you. 10 seconds left, Kingfisher, for you.
We'll go with option E.
Okay, stop the timer and lock option E. You want to lock option E?
Yes, sir.
Lock option E?
Yes, sir. Yes.
Okay, okay, congratulations. Okay, with this, Al Khan, please ask your last question. We will move towards question number 10.
Sure. So question number 10, patient was discharged after observation and readjustment of INR. Same patient presented after a year in OPD for seeking opinion regarding management of anticoagulation regarding perioperative period of herniorrhaphy. He is fine. INR is 2.7. No symptoms. Repeat echo shows adequate functioning of prosthetic valve and good biventricular function. What should be the recommendation in this patient? Option A, continue vitamin K antagonist with therapeutic INR as risk of bleeding is very low in this surgery. Option B, continue vitamin K antagonist with subtherapeutic INR as risk of bleeding is very low in this surgery. Option C, temporary interruption of vitamin K antagonist with subtherapeutic INR and without bridging therapy. Option D, temporary interruption of vitamin K antagonist with subtherapeutic INR and with bridging therapy. Option E, temporary interruption of vitamin K antagonist with aspirin during the perioperative period.
Okay, your time starts now, Kingfishers.
Sir, we will go with option C.
Okay, you still have plenty of time, 65 seconds left. Are you sure?
Yes, sir.
Okay, Hamza. So just stop the timer and lock option C. Right answer. Congratulations. Okay, so with this, we finished the first inning. Hamza, I cannot see the scorecard. Can you just tell us how much Kingfisher scores? Hamza?
They have scored 36 runs.
Okay, congratulations, Kingfisher. You scored 36 runs. With this opportunity, just I want to give a couple of minutes for both teams to just reaccumulate themselves. And in the meanwhile, I would like to move towards Professor Firoz Mehman. Just if he can give his valuable comments about the game which happened up till now. Over to you, Professor Firoz Mehman, sir.
Thank you so much, Asher. Assalamu alaikum, everybody. And as usual, you are doing wonderful job as a referee. But I must say, both teams are very good. The match is as exciting as we are expecting tomorrow. But tomorrow, I don't know the results. Maybe rain can interpret. आज आपका result आ जाएगा. तो दोनों टीमों को आपको जो है इंशाल्लाह. I wish you all the best and I hope you are doing well. The way questions are being asked, it's really wonderful. अच्छा एक चीज मैं कहना चाह रहा था कि इसमें जो मुझे ख्याल है शुरू में ये था. If there's a wrong answer, then we must show the right answer. So if there's any controversy, any dispute or any conflict comments, then we can either change the answer, change something or do a favor to the team who's objecting. The right answer mein dikhana chahiye. This is my suggestion. I hope the other referees, they'll also
right अगर हाँ सर right answer हो जाता है अगर wrong answer आए तो right green जो है वो दूसरा answer जो right होता है वो
green is always the right answer.
ग्रीन जो आता है वो ऑलवेज राइट आंसर होता है अगर ये ऑप्शन से फॉर एग्जांपल ऑप्शन बी इज द राइट एंड
अच्छा आई नो लेकिन इतना छोटा स्क्रीन हम पढ़ नहीं सकते मेरा ख्याल दूसरे लोग नहीं पढ़ सकेंगे अगर वो भी आंसर पढ़ लें तो इट विल बी इजीियर फॉर बोथ द टीम्स टू जस्टिफाई कि उनके साथ ज्यादती नहीं हुई है आई मीन जस्ट सजेशन इफ इट इज ऑलराइट थैंक यू thank you Wilson for organizing such a wonderful program.
Okay, Hamza please हाँ thank you sir for your valuable comments. Hamza please next time कोशिश करें कि स्क्रीन बड़ी हो और सब जो है वो आंसर देख सकें. सर आप जो बात कर रहे थे कि गेम आज फिनिश हो जाएगा मुझे उससे याद आया कि वेदर कराची का तो बहुत अच्छा है. अल्लाह करे कि कल कोलंबो का वेदर भी बहुत अच्छा हो ताकि हमारा मैच जो है कंप्लीट हो जाए कल. Anyway, with this,
sorry, can I just add? पहले जैसे हमजा ने भी कहा था कि जो कार्डियक सुपर लीग वाली स्क्रीन है उसको अगर आप उस पर राइट क्लिक करें और उसको पिन आएगा पिन कर लें तो वो जब भी वो बोलेंगे क्वेश्चन और आंसर वो बड़े आ जाएंगे उसमें आपके.
जी प्रोफेसर खाबर काजमी साहब मैं बस आप ही की तरफ आ रहा था. I would also like your comments for the game which is happened and played up till now.
I think going well. Let's see. अगली इनिंग I think will be exciting देखेंगे. मैं सिर्फ एक कमेंट कह रहा था फवाद बड़े टेंस नजर आ रहे हैं अभी आज तो पाकिस्तान का मैच नहीं है जस्ट रिलैक्स.
थैंक यू. चले थैंक यू वेरी मच. आई थिंक बोथ टीम्स जो है वो रिलैक्स कर लिया होगा एंड नाउ दे आर रेडी फॉर द सेकंड इनिंग. यस गाइस आर यू गाइस रेडी फॉर द सेकंड इनिंग?
यस सर.
Okay,
yes,
so
sir.
now it's Aga Khan starts batting and Kingfisher will gonna ask the questions. So please, Mayo Kingfisher, put your scenario and start asking the questions.
A 53-year-old female presented with heaviness in chest since 1 week of duration. She was having on and off history of generalized weakness, fatigability, increased frequency of urination. She had no past history of hypertension or diabetes. She attained menopause 1 year back. Her lifestyle is very sedentary. Physical examination, obese woman, height 165 centimeter, weight 82 kg, BMI of 32 kg per meter square, and pulse rate of 98 per minute.
Doctor, please close the mic to your mouth, please. And
pulse 98 per minute, regular,
yes,
normal volume, no radiofemoral or non-radiofemoral delay. Blood pressure of 160 by 110 in right and left upper limb. She has having a black velvety hyperpigmentation of the skin, especially on the neck, possibly acanthosis nigricans. Apart from this patch, rest of the systemic examination is normal. Her random blood sugar was 210 as measured by glucometer. Patient was diagnosed as metabolic syndrome. Patient was consulted and explained she is having diabetes mellitus, hypertension, and she has all the signs of metabolic syndrome. Patient was started on lifestyle modification and pharmacotherapy, lipidemic therapy.
cannot see my any last line. I think I cannot.
We
see the
cannot
last line.
we can't read the last line.
Yes, just a minute, just a minute. I even cannot read the last line. Hamza, can you read out the last line for us?
The patient was started on lifestyle modification, diet modification, pharmacotherapy, and lipidemic drugs.
Okay, that's all.
Yes, sir.
Okay, Aga Khan, happy with this?
Yes,
please
sir.
answer. Okay, that's fine. We will move towards question number 1. Yes, please, Kingfisher, ask your question number 1.
Which of the following statement concerning the metabolic syndrome is not true? Insulin resistance and central adiposity are required for a diagnosis of metabolic syndrome. Option B, 3 of the 5 criteria are always required for a diagnosis of metabolic syndrome. Option C, between 20% and 35% of the worldwide adult population has metabolic syndrome. Option D, atherosclerosis risk rises in association with the severity of metabolic syndrome. And option E, residual risk describe the remaining increased risk for atherosclerosis after the treatment of a specific risk factor.
Okay, so starts your time, start now.
Central adiposity. Circumference.
Okay, start. 45 seconds left.
Out of it's correct. It is A है या
30 seconds left.
या तो A है या इसके चले जाते हैं. So option A, insulin resistance and central adiposity are required for the diagnosis of METs.
Okay, Hamza, hold the timer and we'll go with option A. Lock option A, Hamza. Right answer. Congratulations, Aga Khan stars. Nice beginning of your inning. So good luck for the future questions. And with this, Kingfisher, please ask your next question.
Which of the following is not a mechanism by which physical activity affects metabolism? Option A, activation of brown fat. Option B, improvement in insulin sensitivity. Option C, modulation of endothelial and adipose tissue function. Option D, gene activation. Option E, all of the above are mechanism by which physical activity affects metabolism.
Okay, your time starts now.
Which of the following is not a mechanism by which
Okay, 50 seconds left. Alpha stars.
We are not about
Okay, guys, 30 seconds left.
So option E, all of the above.
Okay, so this is your final answer.
Yes, sir.
17 seconds left. Yes, Aga Khan.
Yes, sir. Final answer.
Okay, Hamza, hold the timer and lock option E. Okay, congratulations. Right answer with this. Please, Kingfisher, ask your third question. Yes, Hamza, please.
Which
Yes.
of the following is considered the common starting pathway for the development of metabolic syndrome? Option A, genetic predisposition. Option B, insulin resistance. Option C, systemic inflammation. Option D, accumulation of fat in adipose or non-adipose tissue. And option E, hypertension.
Okay, your time starts now. Khan.
Which of the following is considered the common program? This is starting pathway. So genetic predisposition है ये
accumulation of fat adipose और non-adipose नहीं सिर्फ adipose के होता है non
insulin resistant उसका consequence systemic inflammation is not.
Okay, Aga Khan starts 40 seconds left.
दोनों दिए दोनों adipose और non-adipose
30 seconds left, Aga Khan.
Correct.
Okay, now 20 seconds left. 10 seconds left. Aga Khan, 10 seconds.
Option D, accumulation of fat and adipose.
Okay,
and
Hamza,
non-adipose.
hold the timer and lock option D. Right answer. Okay, very good. With this, we will move towards question number 4. Yes, Kingfisher, please ask question number 4.
What is the approximate annual risk of developing type 2 diabetes in a patient with obesity and metabolic syndrome? Option A, 2.5%. Option B, 5%. Option C, 7.5%.
Yes, it's option C.
D, 10%.
Hamza. Yeah, I think there's a typing error. It's option C, 7.5. Yes.
And option E, 12.5.
Yes, your time starts now. Hamza, please start the time.
What is the approximate annual risk of developing?
Aga Khan, please consider 7.5 as option C, okay?
diabetes दोनों बहुत हैं 2.5 ठीक है it's between 7 both उसके so it's between
Guys, where is Google? Can you check it? What is the answer?
some 5 component it's a guess comparatively
Okay, 40 seconds left. Aga Khan starts. Okay, 30 seconds left.
Okay, so option B, 5%.
Okay, should we lock the option, please?
Yes, sir.
Okay, Hamza, stop the timer and lock option B, 5%. Suppose it's right answer. Okay. Again, congratulations. You are playing very well, Aga Khan stars. With this, I would like to ask Kingfisher for their next question, please.
Which of the following is not true concerning BMI? Option A, National Institute of Health Obesity defined BMI is divided into 3 classes. Obese class 1, BMI of 30 to 34.9, obese class 2, BMI of 35 to 39.9, and obese class 3, BMI greater than 14. Option B, cutoff values for classifying individuals are underweight, normal, overweight, or obese vary by population. And option C, BMI will overestimate adiposity in athletes with high muscle mass. Option D, BMI is a significant independent predictor of cardiovascular disease. And option E, in patient with congestive heart failure, overweight and obesity are protective against mortality.
Okay, your time starts now. Khan starts.
Which of the following is not? ऑप्शन E उस पे सोचना कंजेस्टिव हार्ट फेलियर में ओबेसिटी उसके लिए वो है और उसके बाद वो कह रहे हैं प्रोटेक्टिव सर्विस थोड़ी ये तो रिस्क फैक्टर ये स्टडीज में है कि जो ओबीज है दे हार्ट फेलियर मोबिलिटी ज्यादा होती है मोर्टालिटी ये सेट ऑफ वैल्यू हमें पता है ये दिस इज आल्सो ट्रू ये मैं सिग्नल
Okay, 40 seconds left. Aga Khan starts.
William by D is
Okay, 30 seconds left.
Yeah, option D. No. Option D.
10 seconds left. Aga Khan starts.
It's not. Na, तो वो आपका
Guys, it's 7 seconds left.
Option D. BMI is significant
Okay,
independent
stop
predictor.
the timer
It's
and lock
not a
option
independent-
D. Option D for Delta, isn't it? Yes, option D,
D
please.
for Delta.
Good luck. That's fine. You clicked the last minute. With this, Kingfisher, please ask your next question.
Which of the following is not true about the effects of weight loss on cardiovascular risk factors? Option A, weight loss is the most effective therapeutic approach for treating and preventing the progression of cardiometabolic syndrome. Option B, if weight loss is not sustained over time, its beneficial effects on type 2 diabetes incidence is lost. Option C, weight loss is an effective approach for reducing blood pressure. Option D, weight loss decreases triglycerides and LDL while increasing HDL. Option E, weight loss has beneficial effects on LDL subclass characterized by reduction in small, dense LDL particle concentrations and an increase in medium and large LDL particles.
Okay, your time starts now. Aga Khan start.
तो आपका जो 2 वाला था ना इससे ये पता है उसमें इन्होंने पूछे कि किस वाला था तो आप देखो ऑप्शन ये दोबारा से देखो एक वेट लॉस सेकंड अप्रोच जो ठीक है सो इको what causes and blood pressure is true. Okay, weight loss decrease triglyceride LDL is true. Loss is beneficial for Netflix loss in a large area. So
Okay, start. 50 seconds left.
option B. Option B for beta.
Okay, stop the timer, Hamza, and lock option B. Right answer. Congratulations. Okay, with this, Kingfisher, please ask your question number 7. I think both teams' points or the score is equal now. So it's if Aga Khan answer any question right from now onwards, they will win the game. So good luck, both teams. And yes, Kingfisher, ask next question, please.
Which of the following statements is not true about the treatment of diabetic patients with statins? Option A, for patients with diabetes and non-cardiovascular disease, high-intensity statin therapy is recommended according to the ACC Heart Association guidelines of 2013. Option B, for patients with diabetes under the age of 40 with one additional cardiovascular risk factor, or those with age 40 to 75 without any cardiovascular risk factor, moderate to high intensity statins are recommended. Option C, much of the evidence for the treatment of diabetes with statins comes from subgroups analysis from large randomized trials of lipid lowering therapies in which diabetes patients represented less than 10% of all the patients enrolled. Option D, in the trials of statin therapy with hyperlipidemia, the relative benefit appears to be increased among diabetic patients compared with non-diabetic patients. Option E, in a pooled analysis from the TNT and ideal endpoints
incremental decrease in clinical endpoints.
Patients with pre-diabetes treated with high-intensity compound compared to low-intensity statin were more likely to develop new onset diabetes.
Please close the mic. Please close the mic. Okay, Khan, are you happy with it? We'll start the timer. Okay, I'm gonna start the timer now.
Is pretty low. Okay.
You can read the options as well. It's just for your facilitation.
Last one is so in a pool analysis of the treating new target and ideal increment decrease in the so ideal trials patients with pre-diabetes treated with high cuts compared to low statins were more likely to develop new onset.
Okay, Aga Khan, 50 seconds left. Start. 30 seconds left. 20 seconds left. Okay, 10 seconds left. Aga Khan starts for you. 7, 5, 4, 3, 2, 1.
E,
okay, you lost the. No.
Option
no, E. No. This is the wrong answer now. Time is up. Thank you very much. Time is up. We will go now. Hamza, please ask question number 8. That we will consider a wrong answer, okay?
Hamza, we said our answer when 3 seconds were left.
No. I can, okay, that's fine. That's my opinion, but I will ask both umpires, Sir, Professor Khabar Kazmi and Professor Ishaq Saab. Sir, please, I think I didn't hear anything from them till time gone.
You are keeping a watch on the timer. So if you think the answer came after the expired time, then I think we can't entertain the answer.
Yes, that's what I feel. Yes, Professor Khabar Kazmi Saab.
I agree. I think they answered after time was gone. But I think I would just still suggest that you should show the right answer.
Okay, yeah, we can show the right answer. I'm going to show the right answer, but anyway, we're not gonna include this answer in the number in the count. Yes, Hamza. We'll consider this question as a wrong answer. Okay.
Option D was right, sir.
Okay, option D, and they choose, I think, E, isn't it?
Yes, we answered E.
Okay, that's fine. So anyway,
so in any case,
yeah. So with this, the game is tied with 36 points each, and we'll move towards question number 8. Kingfisher, good luck from now onwards. Not only Kingfisher, also for Aga Khan Stars as well. Yes, ask question number 8.
An asymptomatic 65-year-old man with diabetes is referred to you for screening. With respect to screening for coronary artery disease in patients with diabetes, which of the following statement is true? Option A, exercise testing in diabetes patient is more likely to be accurate when combined with echocardiography or radionuclide imaging.
Imaging.
Option B, diabetic patients are less likely to have an appropriate blood pressure and heart rate response to exercise and less likely to experience any pain in corresponding to ST segment changes caused in part by autonomic dysfunction. Option C, the AHA recommends that the finding of subclinical coronary artery disease should prompt clinicals to initiate more aggressive preventive measures. Option D, the DIAD study has shown that the prevalence of silent ischemia in the diabetic population is not insignificant, but the annual cardiac event rate is less than 1% overall at 4.8 years of follow-up, and routine screening for inducible coronary ischemia did not reduce cardiovascular.
Close the mic, please.
And option E, all of the above.
Before you start the timer, I have a question here.
Hamza, hold the timer. Hamza, hold the timer.
Okay.
Yes, Professor Khabar.
I thought that, you have a scenario in the beginning and all the questions are related to that scenario. This is now a new scenario. So this is a question. I'm not sure whether this is allowed or not. Dr. Ishaq, you would know better.
Yeah, I think I agree with you, Khabar. I think I was surprised that it's not linked with the scenario that we presented in the beginning, you see, because all the questions are supposed to be connected to that scenario. And this is an independent scenario that they are presenting now. Hello?
Yes, sir. Anyway, Aga Khan, do you guys want to go ahead with this? I mean,
sir,
we can ask because
Ashkar, I am not a panelist or referee, but I think I agree. जो हमने शुरू में game शुरू की थी, right from case 1 or for day 1, it was decided एक ही scenario चलेगा, वही discuss होगा, दूसरा scenario नहीं आ सकता है.
Exactly. I have been attending all the matches so far. This is 10th, I think, and it was the same scenario, and the questions were connected to the same scenario. अब तो ये तो बिल्कुल एक independent नया scenario लेकर आ गए हैं लोग. I don't think this is acceptable.
So if that is the case, then I think I would suggest Ishaq Sahab agree that we will just award this question to AKU.
Yeah, that's what I was planning to. If Aga Khan is happy to take the question,
we are okay with the question. We can answer the question.
Okay. That's fair enough. That's fair enough, sir. Because we need to results, for the game. Okay, start the timer now.
जब आपके दो सही होगा तो आप आंसर ई हो ऑटोमेटिकली. So option E, all of the above.
All of the okay. This is your final thought, Aga Khan?
Yes, this is the final answer.
Okay, that's fair enough. Hamza, please stop the timer and lock option E. All of the above are correct. Right answer. Congratulations. And with this, Aga Khan, you won the game. Hamza, I think we don't need to proceed further because this is the knockout game. So the points will not gonna carry. Now it's winning or losing is the matter, isn't it?
Yes.
Yes, sir.
Okay. So congratulations, Aga Khan. You move towards semi-final, and bad luck for Kingfisher. Good luck for next time. Both teams played well. With this, I would just like a couple of comments to my distinguished colleagues. I would like to move towards Professor Fawad Farooq, if he's there. Fawad, can you just give your input, brief input, please? Dr. Fawad Farooq, are you with us? I think he is not there. So I would like to move towards Dr. Imran Iftikhar, is an assistant professor from Rawalpindi Institute of Cardiology. Dr. Imran Iftikhar, are you with us as well? Hamza, is he with us?
No, sir, he's not also with us.
Okay, so that's fine. Then I would like to move towards Professor Ishaq Sahab for his final comments about the game, today's game now. Sir,
thank you. Thank you very much once again for moderating so nicely. I think I enjoyed both the teams fought very well. The questions were very good, but I think as we have already pointed out, we should follow the rules of the game, and we should stick to the scenario, and all the questions should be related to the scenario. But I think it has been a great learning experience for me. I have been attending it right from the beginning, and today both the questions were very good, very pertinent to our day-to-day practice, and the teams had very good fight among themselves, and I think one team has to lose in any case, but the score was quite good on both sides. My only humble suggestion to the people who formulate questions and answers is that we should be brief in scenario and brief in the answer. Sometimes the answers are so long and the scenario is so long that takes quite a while to read it, and then you can easily forget what you have already read. So थोड़ा brief अगर कर दें तो बहुत अच्छा होगा. But I think we are almost close to our final days. And thanks for once again to Wilson for initiating this excellent academic activity. And not only we enjoyed it, but it was relief to see my friends, Professor Khawar Kazmi and Firoz and all others. And I think well done, Asher, well done, Hamza. And,
thank you very much, sir.
And congratulations, both the participants, or both the teams have done a very good job. And they should not be disheartened if one has to lose. Never mind, they have to read again and prepare for the next go, inshallah, jab bhi hoga. So I think with this, I would like to once again thank you all, and in particular, Messrs. Wilson and Hamza for organizing this 10th session. Thank you. I can see now, Tipu, so I think I will take your permission to leave. And
सर सॉरी सर, मैं आपसे एक छोटा सा क्वेश्चन करना चाह रहा था. डॉक्टर फतेह अली टीपू ने हमें ज्वाइन कर लिया. सर अगर आप 2 मिनट रुक सकते हैं तो डॉक्टर फतेह अली का इनपुट लेके मैं आपसे और खावर काजमी से एक इनपुट लेना चाह रहा था. सर इज इट पॉसिबल?
बिल्कुल जी, टीपू साहब को कौन मना कर सकता है. टीपू साहब हमारे दोस्त हैं और उनकी मौजूदगी
2 मिनट.
मौजूदगी बायस से बरकत है.
फतेह अली टीपू साहब, सर प्लीज, if your valuable comments came now.
Tipu, please go ahead.
एक को म्यूट कर देना. आगा खान को उधर ही बैठे हैं असल में.
खान में? अच्छा,
आवाज आ रही है मेरी?
जी जी, आपकी आवाज आ रही है.
जरा वो
आ रही है.
आवाज नहीं आ रही सर? आवाज आ रही है अभी? सर
बिल्कुल आ रही है.
अच्छा, अस्सलाम वालेकुम. मैं वैसे प्रोग्राम मौजूद था, लेकिन मैंने अपने उससे एक्चुअली कनेक्ट नहीं किया था, तो मैं बहुत इंजॉय किया. एंड इनफैक्ट कॉन्ग्रेचुलेशंस टू ऑल ऑफ यू एंड विल्सन फार्मास्यूटिकल्स. और मैंने शुरू का एक प्रोग्राम अटेंड किया था और आज मैंने देखा तो स्टैंडर्ड बहुत बेहतर हो गया है. इनिशियली जो है वो क्वेश्चंस का स्टैंडर्ड भी जरा इतना अच्छा नहीं था, एंड आई थिंक इट हैज़ मच इम्प्रूव नाउ. दूसरी जो चीज़ है ना, वो एक थोड़ा सा मेरा सजेशन है, वो ये है कि जो परसेंटेजेस वाले जो आंसर्स और क्वेश्चंस है ना, वो आई थिंक नहीं होने चाहिए. वो सिर्फ रिकॉल को और वो इस तरह से है. बाकी अदरवाइज बहुत ज़बरदस्त स्टैंडर्ड था. एंड आई थिंक दोनों टीमों ने बहुत अच्छा प्ले किया. और कॉन्ग्रेचुलेशंस टू बोथ ऑफ देम एंड स्पेशली AKU जिन्होंने विन किया. तो एंड आई थिंक अगेन तो ये जैसे साहब ने और खावर ने कहा कि ये तो एक ऐसी एक कंपटीशन है, इसमें कोई जीतता है कोई हारता है, तो इसमें कोई ऐसी बात नहीं है. पर अच्छी चीज़ ये कि बहुत हेल्दी एक्टिविटी है. एंड कॉन्ग्रेचुलेशंस टू ऑल ऑफ यू, स्पेशली विल्सन फार्मास्यूटिकल्स.
थैंक यू वेरी मच सर. थैंक यू वेरी मच फॉर योर वैल्यूएबल कमेंट. सर आपसे और डॉक्टर खावर काज़मी से एक सवाल मैं हमजा आपसे भी करना चाह रहा था कि फाइनल या फिर अगर आप समझते हैं सेमीफाइनल्स, उनको अगर इंक्लूड कर सकते हैं कि अगर उसमें हम जो है वो सिंगल सिनेरियो बेस्ड क्वेश्चंस अगर ना रखें और ओपन क्वेश्चंस रखें 10 जो कि कहीं से भी पूछ सकें, तो क्या ख्याल है ताकि उस स्टैंडर्ड को हम मेंटेन रख सकें क्वेश्चंस के? सर आप लोगों का क्या ख्याल है?
मेरा ख्याल है कि जो फॉर्मेट चल रहा है उसी को फॉलो करें, उसी के बेस पे टूर्नामेंट चल रही है ना, तो आई डोंट थिंक वी शुड डेविएट फ्रॉम दैट.
सर हमें जो फीडबैक मिल रहा है ना, वो जो क्वेश्चंस बना रहे हैं वो ये कह रहे हैं कि तमाम टॉपिक्स क्योंकि यूज हो चुके हैं तो
अरे यार बहुत
उनको
टॉपिक
थोड़ी
हैं, बहुत
दिक्कत होगी।
अभी बहुत टॉपिक हैं, क्या बात करें, टॉपिक बहुत ज्यादा हैं।
सर डॉक्टर खावर आप क्या कहते हैं?
देखिए
सर
आप एक
बहुत
पहली
सारे हैं एंड आई थिंक सिनेरियो बेस्ड ही होना चाहिए। सिनेरियो बेस्ड जो है वो सही तरीका है एंड आई थिंक टॉपिक्स तो बहुत हैं, तो अभी तो बहुत कुछ बन सकता है।
नहीं
थोड़ा
सर,
बेसिक्स की बार जाएं,
सर
बेसिक
आई
बेसिक
एग्रीड
को
विद
उन्होंने
सिनेरियो
टच ही नहीं
बेस्ड, मैं
किया।
सिनेरियो बेस्ड से
आई थिंक देखे अभी इस वक्त तो मेरा ख्याल चेंज नहीं करना चाहिए बिकॉज यू
या
आर नाउ इन ऑलमोस्ट द फाइनल स्टेजेस, सो आई थिंक वी शुड कीप द सेम फॉर्मेट। मेरा ख्याल जो क्वेश्चन वेट करती है टीम, आई थिंक दे नीड टू डू अ लिटिल बेटर जॉब बिकॉज आई थिंक कुछ चीजें नजर आती हैं जो थोड़ा सा होता है। जैसे आज जो सेकंड था जो मेयो किंग्स ने जो सिनेरियो था उसमें देर इज अ कंट्रोवर्सी ऑन द डेफिनेशन ऑफ मेटाबॉलिक सिंड्रोम जो डायबिटिक एसोसिएशन है उसकी और जो कार्डियोलॉजी की जो हमारी है। तो आई थिंक उन्होंने किसी जगह ये मेंशन नहीं किया कि वो किसकी डेफिनेशन को आगे फॉलो करना चाहते हैं, बट फॉर्चुनेटली आई थिंक AKU ने जस्ट आंसर द राइट वे। तो वो दूसरा उनका जो सेकंड क्वेश्चन था वो टोटली फ्लॉड। अगर आप उसका जो ई आंसर जो करेक्ट हुआ वो करें तो वो सारा सिनेरियो खराब हो जाता है, क्योंकि वो तो ऊपर तो कह रहे हैं कि ये हो नहीं सकता, तो जब आप नो है डबल नो ओके तो वो तो दिस वाज सो आई मीन आई थिंक दोज हु आर वेटिंग द क्वेश्चन दे शुड
यस,
डू अ
ये भी
बेटर जॉब, ताकि
टॉकिंग टू
ये
देम।
भी एक इनके लिए लर्निंग है कि हाउ डू यू मेक दीज क्वेश्चंस। बाद में आप लोगों ने जब ये एग्जामिनर बनेंगे तो यही क्वेश्चन इस तरह के बनाएंगे। तो मेरे ख्याल में हमें अपनी जो टीम है उनको ज्यादा करना चाहिए करेक्ट, और अभी फिलहाल तो ये सिनेरियो इसी तरह बरकरार रखना चाहिए जो अभी सिलसिला चल रहा है। कंग्रेचुलेशंस टू AKU स्टार्स एंड बेस्ट विशेस फॉर द नेक्स्ट इवेंट। एक मेरा ये सजेशन है अगर पॉसिबल हो सके मे बी विल्सन की तरफ से कि आई थिंक सेमीफाइनल और फाइनल जो है वो जूम पे भी हो, लेकिन डू इट इन पर्सन ऑल्सो। आई थिंक देयर विल बी लॉट
सर
ऑफ
फाइनल का
मेरिट
तो
इन
हमारा प्रोग्राम है
इन
सर,
इवन
हमजा आपको डिटेल में बताएंगे। फाइनल तो
सेमीफाइनल।
मतलब
सेमीफाइनल भी होगा, अगर दो
Ashar,
सेमीफाइनल और एक
I have to
फाइनल होता है
leave,
तो तीन
and
जगहों पे होते हैं।
ओके,
can
ठीक
I
है
just,
सर।
I think I would like to agree with the Khabar. जो क्वेश्चन बनाते हैं थोड़ा सा पहले भी हमने उनको पॉइंट आउट किया था और फिर कर रहे हैं, लेकिन आई थिंक वी शुड कंटिन्यू इन द सेम पैटर्न एज वी बीन डूइंग इट। और मे बी जब नेक्स्ट टूर्नामेंट होगी तो उसमें फिर नई चीजों को हम
ठीक है सर, थैंक यू
इंट्रोड्यूस कर
वेरी मच,
सकें।
गॉट योर पॉइंट,
और
गॉट योर पॉइंट। अच्छा,
विद दिस थैंक यू वेरी मच एंड अल्लाह हाफिज।
थैंक यू सर, थैंक यू वेरी मच। हमजा
Sir,
जी, हमजा आप अगर एक्सप्लेन कर दें
I
डॉक्टर
have
खान
noted
को।
Professor Khavar Kazmi's suggestion as well regarding a physical of semi-final, and I think
उस तरह
I
ये होगा, देखिए अगर आप दो सेमीफाइनल और एक फाइनल करेंगे तो आप 3 सिटीज में कर सकते हैं, यानी
sure sir,
मे बी एक लाहौर हो सकता है, एक कराची हो सकता है, एक पिंडी हो सकता है। तो आई थिंक यू वुड बी कवरिंग 3 मेजर सिटीज और पिशावर वट एवर जो भी हो। तो आई थिंक इन दैट वे
very right sir, suggestion noted sir. Thank you so much sir for your
हमजा
suggestion.
हमजा एक सजेशन मेरी भी है कि ये जो हम क्वेश्चंस अभी थ्रो कर रहे हैं इसमें इसकी ना एक सेकंड लेयर या थर्ड लेयर चेक भी बना दें। मेरा अगर 2 लेयर से ये गुजर रहे हैं क्वेश्चन सिनेरियो तो एक थर्ड लेयर भी बना दें, क्योंकि इसमें फिर कुछ चीजें हैं जो कि ना देखने वाली हैं, ताकि
Sure sir.
जैसे कि प्रोफेसर इसाक हैं या डॉक्टर खावर काजमी है या कोई और हैं जो इसको एक फाइनल रीड भी कर लें बिफोर वी थ्रो द क्वेश्चंस इन द गेम्स।
Very right sir.
ठीक है, चले, थैंक यू वेरी
ओके,
मच, थैंक
बहुत
यू वेरी
शुक्रिया,
मच
थैंक
बोथ
यू।
टीम्स, thank you
I'm
sir.
extremely
I would
thankful.
like to thank you everyone, and with this we will see off and we will meet with the next quarter final. Thank you.
Thank you
Allah
very much.
Hafiz. Allah
Congratulations
Thank
Hafiz.
you,
to all
sir.
12 stars, and I'm extremely thankful to all the panelists, including Dr. Ashraf Bilal for moderating this program. And with this, I would like to sign off. Thank you. Allah Hafiz.